Tetralogy of Fallot. The blue baby. Tetralogy of Fallot is a congenital heart defect, in which a baby has 4 different heart problems. Tetralogy of Fallot consists of 4 features. Pulmonic valve stenosis, a large ventricular septal defect, right ventricular hypertrophy, and overriding of the aorta. The acronym PROVE can be used to help remember the 4 specific abnormalities generally associated with tetralogy of Fallot. PROVE means P for pulmonary infundibular stenosis, R for right ventricular hypertrophy, O for overriding aorta, V for ventricular septal defect. The E is silent without an associated pathology. The defects occur together and change the way blood flows through the heart and lungs. This causes deoxygenated blood to mix with oxygenated blood. Babies born with tetralogy of Fallot often have blue or gray skin due to low oxygen levels. Symptoms include cyanosis, dyspnea with feeding, poor growth, and hypercyanotic TET spells. What are these hypercyanotic spells? Hypercyanotic TET spells are sudden, dangerous drops in blood oxygen levels in infants with tetralogy of Fallot. This causes intense blue or gray skin, rapid breathing, and irritability. Sudden episodes of profound cyanosis and hypoxia, hypercyanotic or TET spells, may occur, which may be lethal. It is triggered by crying, feeding, or stress. A spell may be triggered by any event that slightly decreases oxygen saturation. For example, crying, defecating, or that suddenly decreases systemic vascular resistance. For example, playing, kicking legs when awakening, or by sudden onset of tachycardia or hypovolemia. They require immediate intervention, usually bringing knees to the chest, to increase blood flow to the lungs. These spells occur in some children with tetralogy of Fallot, most often those between 2 to 4 months of age, though they can happen anytime from birth up to 12 months. X-ray of tetralogy of Fallot. Chest X-ray of tetralogy of Fallot shows a classic boot-shaped heart. This has following features: upturned cardiac apex. Right ventricular hypertrophy causes an upturned cardiac apex. This cardiac apex is positioned abnormally high, above the diaphragm. Concavity of pulmonary artery segment. Pulmonary stenosis leads to a small main pulmonary artery. This occurs due to a decrease in blood flow through that artery. This is shown on X-ray as increased concavity of pulmonary artery segment. Large aorta. Overriding aorta in tetralogy of Fallot is associated with pulmonary stenosis plus ventricular septal defect. All these features function together to shunt blood away from pulmonary system. Therefore, the aorta is large. This appears more right-sided on X-ray. Pulmonary oligemia. Due to shunting of blood away from pulmonary system, there is decreased pulmonary vascularity. That is shown on X-ray as decreased lung markings. This is called pulmonary oligemia. The lungs appear more translucent, blacker, on chest X-rays, often with smaller, narrower vessels. Gold standard for diagnosis. The echocardiogram is the gold standard for the diagnosis of tetralogy of Fallot.